people go to more extreme measures for perfect skin. Plastic surgery is not only popular in Western countries, but also in Southeast Asia. Andrew, have you ever considered getting plastic surgery?
Well, personally, I never considered it before, but I have a bunch of friends that had it before. So far, it looks good.
Plastic surgery is more common these days in the United States, but in Korea, personal reengineering is even a bigger business than it is here. It is so popular that most doctors advertise their services in magazines. People from all over Asia visit Korea for beauty tours. A beauty tour is booked like a traditional vacation. They include airfare, lodging, sightseeing trips, but also a visit to the doctor. These guests often stay in large furnished apartments with up to 3 bedrooms, living room, and kitchens with fully stocked fridges. But what surgeries are Asians flocking to Korea to have? Nose jobs are the most popular, as are eye, chin, and forehead augmentations. Duck Young Kim, a highly respected plastic surgeon in Seoul, South Korea. His clinic is state-of-the-art and world-renowned. He consults with dozens of patients daily. This craze of re-engineering even spans to teenagers. Many Korean parents are giving plastic surgery to their kids as graduation gifts. But starting with these procedures at such a young age may cause them to grow up wanting and needing more surgeries.
Having a better physical appearance is not only popular in South Korea, but also here in the Western world.
I'm a board-certified plastic surgeon in San Francisco, and my practice scopes from aesthetic surgery to reconstructive surgery. My customers for aesthetic surgery range from patients from 14 years old up to 92 years old. For example, people in their 20s usually have breast augmentation or liposuction or nasal surgery. In the 30s, people are starting to have eyelid surgery performed. 40s, they're having a little bit of everything, maybe tummy tucks after having children.
What are some of the examples of aesthetic surgery?
There are many forms of aesthetic surgery. They can range from making things bigger to making things smaller. In terms of smaller, one of the more common operations for younger patients is liposuction, where a device is put in and the fat is removed. But now there are devices that even don't involve an incision. You put a device on top of the skin, and with suction, massage, and laser energy, you can reduce the amount of fat without ever making an incision.
What are some of the latest technologies?
We have some new technologies. We just completed a study for treating cellulite. Now, cellulite is not a common problem for men, but many women feel that they have cellulite, which is an irregularity of their thighs or abdomen. And this new technology is non-invasive, and it actually smooths the skin over a series of treatments. And the study just completed last year that will be published in June of this year in the medical journal shows that the results have lasted for 6 months without any touch-ups.
What do you mean by irregularities?
Well, see, you're a male, so you wouldn't know what cellulite is, but I bet you if you had talked to some women, they don't like the irregularities of their lateral thigh. It looks wavy, like ripply of water, and lumps and bumps and divots. So when they wear their swimsuits or shorts, they don't like to have that contour irregularity. And that's what cellulite looks like.
This is a rather personal question, but have you ever had aesthetic surgery yourself?
Well, indirectly, I was playing basketball and I had my nose broke, so I had to have it put back together again.
That's about it.
That's about it. And I had skin treatments. So I had sun damage on my skin, so I've had some skin treatments. Best thing I've ever done.
I don't know. I think I'm still gonna stick with my cosmetics.